It's Local Edition. I'm Brad Pomerance in the Coachella Valley. Today we are joined by David Brinkman. He is the CEO of Desert AIDS Project, an organization that has been around for, you told me, 33 years. It's amazing that the AIDS epidemic has been with us for that long. And I guess I would ask, is AIDS still an epidemic?
Unfortunately, it still is, Brad, in the U.S. and worldwide. Right now in the U.S., there's a new infection every 9.5 minutes.
Really?
And worldwide, there's a new infection every 2.5 minutes. So even though we have the opportunity to end the epidemic, we haven't done the work yet.
And I'm wondering if we can kind of reflect on this decade versus the 90s, for example. In the 80s and 90s, everyone was in a panic. Gay or straight, didn't matter. It was seen as the plague. Now, because treatment is so effective, is it tricky to kind of get the message out that if you can avoid being HIV positive, it's probably for the best?
There's no doubt that today, if you live with HIV and you're in healthcare, you can live your entire life expectancy. And so
that is just beautiful and a miracle.
Right. It is wonderful.
Right.
And it's been a huge investment from our federal government into research, into science that has brought us there, but of course also worldwide. There's no doubt that that stands there. It does affect how people see themselves vis-a-vis the risk and vis-a-vis their concern about contracting HIV.
And is that part of your work? Because as I've understood it, it's important to be tested, because if you happen to be positive, if you get into treatment, your infection, the ability for you to pass the infection drops dramatically. You're a lot healthier.
Absolutely. As soon as somebody knows they're living with the virus, as soon as you get on medications, you can live a much healthier life and not have permanent damage from that virus. And as you said, you can become uninfectious. And so there's all sorts of reasons to know if you're living with the virus and you've not been tested.
So let's talk about your work.
Okay.
There is a program called Get Tested Coachella Valley. Tell us about that program.
That is our local program that has been recognized by the White House as one of the most effective programs to end the epidemic. What we really need to do is routinize HIV testing in all medical settings. HIV is a virus, just like the cold is a virus.
Truly.
Anybody can get a cold and anybody can get HIV. HIV, though, shows no symptoms, oftentimes for up to a decade. And so the only way to know is to get an HIV test. And so Get Tested Coachella Valley's mission is to ensure that all the primary care medical providers and in places like emergency departments are testing everybody for HIV, because there's no way by looking at somebody that you can identify that they're carrying the virus. Once somebody knows that, our next step of Get Tested Coachella Valley is linking them into healthcare.
Right. What's also interesting about modern medicine is that there are medications you can take. It's almost like the birth control pill before or the morning after pill after. These are known as PrEP and PEP. A lot of folks may not know about PrEP and PEP. Tell us about them.
Right, very different than in the 80s and 90s. There is a new way to prevent the virus, and that is through taking a daily medication for somebody who is high risk of getting the virus, who is HIV negative, and that is PrEP. And
explain PrEP. What is it, the regimen, and how your organization's involved in its distribution?
So PrEP is FDA approved. It's a prescription drug. You take it once a day, and the research has proven that it is extraordinarily effective. Much research shows it's 100% effective in ensuring that you don't get the virus.
So if you have relations with someone, if you use a needle that someone used and there was HIV present, you're not going to get HIV?
Right. It'll knock out the virus before it becomes a part of your system.
And can one get PrEP through the Desert AIDS Project?
You can get it at Desert AIDS Project. We have a clinic called The Doc.
Tell us about The Doc.
The Doc is our sexual wellness clinic. It's a center of excellence for prescribing both PrEP and PEP. But if your viewers are watching this and not living in this part of California, you can go to a primary care provider and talk to them about getting this prescription. If you go to the CDC website, they have all the information you need and also your physician needs to consider whether or not this is the right drug.
Now tell us about PEP.
PEP is, like you described, the morning
Right,
after pill.
right.
If you think you've had a high-risk exposure, you've had relations with somebody who you don't know their history,
Right.
but you have enough knowledge to believe that they may be high risk themselves, maybe somebody living with HIV,
Right.
then go to see a physician or go to the emergency department, because today we have a pill that if you take within the first 72 hours after exposure, there's an 86% chance it'll knock the virus out of you within 30 days. And so what a wonderful opportunity we have to help end the pass of the spread of the virus.
Truly. I want to talk more about what you're doing, because it's not just focused on HIV, it's about sexual health, I guess you can say. What we know is that we've seen a spread of other STDs. Talk to us about the work of the Desert AIDS Project in that arena.
Just this past year, the CDC came out with information saying that syphilis is at an all-time high in US history right now. Syphilis is similar to HIV in that you can live with it for a decade, sometimes even more, with very little symptoms. But syphilis is a very, very serious virus. It can cause permanent damage, neurological damage, blindness, and if so untreated, it is a very, very serious disease.
And as I understand it, in the gay male population, there seems to be a spike amongst gay men.
Yep, we're seeing a spike in that in California for sure, and probably other places in the United States. People need to get tested for syphilis as part of their annual exam. People who are very sexually active need to get tested more than once a year. Additionally, Hep C is another challenge right now in the United States. We've seen a dramatic increase in the number of HIV or Hep C infections in the last several years in the United States. Hep C, also very similar to the other two we talked about. You can live for a long time, show no symptoms, and then find yourself developing cirrhosis, permanent liver damage, moving into liver cancer. And so Desert AIDS Project uses our holistic model, uses our wellness clinic, The Doc, as a way to test people for Hep C, syphilis, and HIV.
I want to ask you about the transgender community. What we know, there was a study that came out recently. We believe there are maybe 1.45 million folks that are transgender in the United States, up from 700,000. So it really is a community that is growing. Is Desert AIDS Project involved in servicing the needs of the transgender community?
We are. Our value system reflects that of caring for people who are marginalized. And certainly the transgender community is a community that oftentimes does not have access to health care and culturally competent health care. And so we are a perfect fit to provide primary care, hormone therapy, mental health, dental care, all of those type of programs that every American deserves.
If someone wants to get involved in the Desert AIDS Project, how can they do it?
They can call us, email us, or go to our website. Our website is desertaidsproject.org. That's probably the easiest way to connect to us. Our phone number is 760-323-2118. We have over 600 volunteers. That's how we make our mission happen, and we welcome people who'd like to donate or volunteer their time.
I thank you for what you're doing. It's very important work, and I honor you.
Thank you,
His
Brad.
name is David Brinkman. He is the CEO of the Desert AIDS Project in the Coachella Valley. My name is Brad Pomerance. You're joining us on Local Edition. Great job.
Thank
Great
you.
job. No